Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Welcome back to the Better, Brighter You segment brought to you by Sespera, the gold standard in treating hyperpigmentation. Hyperpigmentation affects millions worldwide, disproportionately impacting women and people of color, and research shows that it can take an emotional toll equal to or even greater than acne. Today, we're bridging the conversation between pioneering regenerative medicine and proven dermatological treatments like Cyspera. Joining me is Dr. William Gael. He's a board-certified physician, innovator, and founder of the Gael Center in Midtown Manhattan. He has over 20 years of leading experience through breakthroughs in anti-aging, engineered immunotherapy, and regenerative skincare. He's not only an educator to physicians worldwide, but also a patented product developer whose work has gone public in those biotech spaces. Welcome to the show, superstar.
Thank you very much. Wow, that was a great introduction. Thank you so much.
Excited to have you.
As I am here too. Thank you.
So let's chat the science of renewal. Regeneration has become a buzzword, not just in medicine, but also in aesthetics. And it's on everyone's lips, from stem cells to growth factors, yet often it's misunderstood.
Yes.
So for the skin, we know renewal is critical. Our epidermis turns over every 28 days or so. Collagen production slows as we age, and oxidative stress compounds damage. And at the same time, hyperpigmentation remains a persistent challenge. Of course, one that Sespera has directly addressed with targeted science-backed tech, which I love. So from your perspective, what role does regeneration truly play in maintaining and restoring skin health?
So regeneration it's exactly like you said. There's always cell turnover. In fact, I don't know if the listeners know, we have about 60 billion cells a day that turn over. I mean, think about that. We're talking in the billions. That's how many cells in our body turn over every single day. And there's one cell that is known as senescence, which means, you may have heard that before, but senescent cells are cells that are starting to get inflammation, and they're going to die, but they're not dead yet. And so as these cells are aging and dying, they stimulate inflammation. And I think we all know inflammation is the root of all evil. So if we can lessen senescent cells, we can actually be healthier. And so there's a whole section of medicine called senolytics, which are trying to figure out a way to lessen senescent cells. But senescence leads to aging, inflammation, hyperpigmentation, all those types of things, all those bad things that we don't want. So one of the things that we've started doing is to incorporate stem cells into our skincare. And how do we do that? Well, we actually can take stem cells, and stem cells make these little tiny particles of protein called exosomes. Now, I don't know if the listeners are familiar with exosomes, but the way that I make an analogy is to think of the stem cell as the queen bee, and think of the exosome as the worker bee or the drone. That worker bee does all the work that the queen tells it to do. So what we have done is incorporated the stem cells exosomes, those are the worker bees, into serums that when we put on topically will sink into your skin, get down to the deep dermis. The exosome will then renew the fibroblast, and then you get new skin. You'll start to see, you're right, you'll start to see scars go away. You'll see lumps and bumps go away. You see your pores get tight. It's all in the fibroblasts. It's all in the deep dermis. The trick is how to get down there.
Now that's fascinating, because
Yeah.
I want to this I'm going to go into the next question. It really reframes regeneration not as a gimmick, but as a core part of how skin functions and heals.
Absolutely.
I just learned something. So let's chat risks, realities, and research. So whenever there's innovation, there's also hype, right? And we've seen regenerative claims plastered across everything from serums to supplements, and the average consumer has no way of separating science from marketing. Meanwhile, patients with pigmentary disorders are hungry for real solutions.
Right.
Studies, in fact, show nearly 40% of dermatology visits among women of color are pigment related. And that's why clinically proven treatments like Sespera stand apart from just the trending products. So how well are regenerative therapies actually understood today? And what risks should patients be aware of when evaluating what's on the market?
I completely 100% agree with you. There's so much hype out there. There's so much statements out there with not proven. It's really difficult to know what really works, what really doesn't work. Sespera, yes, really works. I use Sespera on everybody that has hyperpigmentation, and I love Sespera. It works really, really well. When I also want just an improvement in my skin, let's say the quality of my skin, besides the hyperpigmentation, I add to it a serum, like I said, that has the exosomes. Now, here's the problem. Who has good exosomes? Now you have to go back to who has good stem cells that made good exosomes. It's impossible to know. The only way you can know is by usually speaking to someone who has used a product that really works, or if you know someone like me who's done their due diligence for the last 15 years. So I almost want to say, I hate to say it's almost like trial and error, but how could you possibly know? Yes, we know Sespera works. There's no doubt about that for hyperpigmentation. But how do you know about all the commercials on TV, all the advertisements you hear in magazines? It's impossible to know what really works and what really doesn't. So I can tell you, because I have a lab where we actually do have our stem cells that produce our exosomes. It's in Arizona, and I work with a biochemist who's a partner of mine in Los Angeles. And everything we do is in the United States. And I prove to people how things work because I actually have objective evidence of how good our products are.
It's a good reminder, Dr. Gail, that not every shiny new product is safe, right, or effective, and patients really need to look for true clinical validation. So I love that you took that verification route, clinically proven, clinically researched, clinically verified, and I know that that's important. Now let's chat career turning point. So you've worn many hats: physician, researcher, educator, innovator, and at the same time, patients often inspire the next phase of a doctor's career. So for example, in the hyperpigmentation space, so many physicians wanted a treatment that worked beyond bleaching agents or lasers, and that gap led to innovations like Sespera. So
Right.
was there a turning point in your own career that pushed you beyond clinical practice and into the world of product development?
Yes, that's a great question. Wow, that's a while ago. I would say it was back in about 2008 or 9. I took a course called Stem Cells in Aesthetic Medicine, and that led me actually to start doing hair restoration by getting stem cells from people's own fat and then
Wow.
putting it in their scalp. And that led me to meeting people that are scientists that work in labs, where I started doing research of getting stem cells and using them intravenously in studies for people that had disorders that were systemic, like lupus and rheumatoid arthritis, and also then injecting stem cells into like knees and shoulders, all part of clinical studies, which then eventually led me into really regenerative medicine from aesthetic dermatology. And one of the studies that I'm into that just happens to be because of associations you meet in networking is using a drug right now that I can't say the name of or the company, where we're using an intravenous drug for reversing dementia right now. So
Wow.
people that have Alzheimer's disease, Lewy body's dementia, even people that have multiple sclerosis or who have had a stroke, Parkinson's, we can give them a drug intravenously and reverse it. Not halt the progression, but reverse it. But that's all I can say about it because we're in between a phase 2 and a phase 3 study. So I do that in my practice, and I have people fly to me from all over the world, including Saudi Arabia, and London. They come to me to New York City. But I also am involved, believe it or not, in with a company that takes people that have bad stage 4 cancers, and they take their tumors or their cancer and they decode the RNA sequence of that tumor and then build a vaccine to kill it. And they're fast tracked for FDA approval. It works so well. So we basically have almost a get out of jail free card. But you
Wow.
could.
I'm going to come to you for any of the, because you've covered everything there. And now let's chat from clinic to lab. So the Gale Center has been a hub for regenerative medicine and aesthetic dermatology for over 2 decades. But what makes your work so compelling is that you're seeing patients every day. You understand their struggles with aging, with discoloration and skin resilience. that hands-on clinical perspective is so valuable in an era where many quote unquote skincare brands are designed purely by marketers, right?
Right.
So how has your day-to-day patient care influenced the way you approach innovation in skincare and technologies that you choose to develop?
So I have developed a way of applying exosomes because exosomes, which come from stem cells, they do the work of the stem cells. They want to reduce inflammation. Inflammation is the root of all evil, let's say. But let's say in my daily practice, I'm using CO2 laser, I'm using microneedling radio frequency, I'm treating hyperpigmentation every day. And like I said, I use Sespera on everyone. They take Sespera home. But in my office, I will use a what almost looks like a sun tanning device and spray my exosomes on the skin because I know they're sinking in through the pores. And I know if I use them, I'll have less downtime for whatever I do, and the person will get a better result. So if there's something I can do to lessen the amount of downtime someone's going to have and give them a better result, I put them on before I start my treatment. Then when I do a treatment, after I do like one pass of laser, I put my exosomes, I spray them on again. They dry in about a minute, and then I continue doing my treatment, and then I put my exosomes on. And then when people go home, one, they use Sespera, and two, I have a certain serum that I developed that incorporates exosomes and something called peptides to reduce inflammation and stimulate collagen growth so that people get a better result.
Oh, you have it down to a science, don't you? Now, and when it comes to skin tone and clarity, okay, patients often look for a combination approach. They try lasers, they try peels or prescription agents, but none are perfect. So when we go back to the narrative, Sespera has actually earned its place in the only clinically proven non-hydroquinone treatment for stubborn
Right,
hyperpigmentation, and
right.
derms all over the world are using it as part of a combination therapy. So, in your view, how do regenerative products complement established treatments like Cyspera and lasers or chemical
I
peels?
love that you talk about Sespera because I love Sespera. It works very, very well. I use that in combination, believe it or not, with a sunscreen that I developed. And its name, I'm calling it Exo Sun. Why Exo Sun? Because it has exosomes in it. So I like to use exosomes in all of my products because it is skin regenerative. So we're renewing your skin. Now, this is what you're really going to like. We have sun protection factor that covers 97% of the sun's ultraviolet rays with the SPF. We have my exosomes for skin regeneration, but we incorporated a compound into it that repairs damaged DNA from the sun's ultraviolet rays so you don't get skin cancer. That's never been done before. I don't want to say what it's called, it's very technical, but it's an actual compound that we make in our lab that will delete the gene mutation that the sun's ultraviolet rays cause. And here's a little technical: DNA always has two amino acids that bind to each other. It's always A to T and G to C. Well, when the sun's ultraviolet rays hit your skin, it causes a gene mutation where A no longer binds to T. Instead, the thymine, which is T, binds to another thymine in our DNA, and that's called a T dimer. I know that's technical, but what does that lead to? That leads to actinic keratosis, which leads to squamous cell skin cancer, and the T dimer leads to basal cell cancers. So what we've done in the sunscreen is incorporated a product that reverses the T to T bond or the T dimer and makes it go back to the A, which is
Wow.
adenosine. Yeah, so we're actually invented something that reverses the gene mutation that leads to skin cancer in our sunscreen. And
That's
I
such an
combined that with
exciting vision.
Sespera. Yeah,
That's exciting.
yeah,
And you're blending cutting edge regenerative science with proven treatments, giving
exactly.
patients that real long lasting
Right.
results. And one of the challenges in aesthetics, I think, is misinformation, right? I mean, whether we're talking about Sespera, any one of the other major companies that you're working with, they all had to overcome early skepticism by proving their results in clinicals. Regenerative skincare is often clouded by myths. We've been saying this. And some people believe that the word regenerative means instant results, while others confuse it with unsafe or untested stem cell claims. So, what misconceptions about regenerative skincare would you like to see left behind, especially as patients turn to more evidence-based treatments like what you're talking about?
I love that, because one of the questions I'm always asked is, I'm just going to lead, is plant stem cells. They'll always ask me, well, how do plant exosomes and plant stem cells work? And I have to tell people that plants are good for plants, but not for people. A plant stem cell slash exosome will never generate a person's tissue, let's say, or skin. So one of the jokes I like to say is, plants exosomes are great if you want to make a salad, but they're not good for us.
So looking 5 to 10 years down the line, where do you see regenerative skincare heading, and what breakthroughs do you think patients should look forward to?
Uh, More stem cells slash exosomes to regenerate the dermis, the fibroblast, like I talked about. That's the most, I would say, innovative, let's say, technology ever invented. But I wanted to say one thing about the biochemist that I've worked with.
Mhm.
She made the first peptide skincare cream ever. So we're going to talk about the length of time. That was 1995. She took vitamin C and 3 amino acids, and one of them is called proline, and vitamin C stimulates collagen. So when you talk about how things have moved forward, that was 1995 was the first one to ever hit the market. And now here we are 30 years later, where we're now taking her peptides but wrapping them around as stem cells product and exosome. I think that is so futuristic, but that's just going to, hopefully people will be able to improve upon what I've done, we've made a cocoon of collagen producing amino acids to protect basically a stem cell slash exosome to give us new skin. I don't know who's going to do it, and I don't know how I can get more futuristic than that. But
Wow.
but this is really amazing stuff we're talking about right now. It's happening right now.
All
So
right.
yeah.
Well, we are at the end of our date. We could continue on for another 30 minutes, but
Oh, easily.
yeah, you are fascinating, my friend. Thank you so much for coming on.
Thank you. I look forward to meeting you and letting you try them.
To learn more, you can visit Sespera.com, and you can follow Dr. Gail's work at drwilliamgail.com and on Instagram at DocManhattanNYC. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by Sespera. If skin discoloration is making it hard to find your Zen, Sespera can help. Stubborn pigmentation, dark spots, and uneven skin tone concerns go beyond the surface, affecting both confidence and self-expression. In a sea of skincare choices, Sespera stands apart. Backed by science and trusted by dermatologists worldwide, Sespera is powered by the advanced cysteamine isobonic amide complex, delivering clinically proven results and effectively targeting mild to persistent discoloration while restoring the skin's natural glow. Unlike harsh treatments, Cyspera is formulated for all skin types, including sensitive areas, ensuring visible improvements without irritation. Whether pigmentation is a new concern or a long-standing struggle, Cyspera works in harmony with the skin to bring balance, clarity, and renewed confidence. Cyspera is science-driven skincare for confidence that shines. Find your skin zen and restore your glow with Cyspera today by heading to Cyspera.com.